January 17th, 1945, somewhere in the Ardennes Forest, Belgium. The surgical tent trembled under the weight of snow accumulating on its canvas roof. Inside, kerosene lamps cast trembling shadows across makeshift operating tables fashioned from ammunition crates and salvage doors. The air hung thick with a metallic tang of blood, the acrid bite of ether, and something else. Something the German nurses had never encountered in their years of service to the Reich. The scent of fresh coffee brewing in the corner, incongruous and almost obscene in its normalcy. Schwester Margaret Hoffmann pressed her back against the tent's interior wall, her Red Cross armband now a liability rather than protection. Her hands, which had sutured countless wounds in field hospitals from Stalingrad to Normandy, trembled as she watched an American Army surgeon, Captain Daniel Kerrigan, according to the name stenciled on his bloodied surgical gown, work with an intensity that seemed both familiar and utterly foreign. Around her, 7 other German nurses stood in various states of shock and exhaustion, their crisp gray uniforms now creased and stained, their carefully maintained composure cracking like river ice. In spring, they had surrendered 3 days earlier, emerging from a collapsed aid station with white flags fashioned from torn bedsheets. They had expected interrogation. They had expected imprisonment. Perhaps they had even expected execution, given what they knew their own forces had done to captured Soviet medical personnel. What they had not expected, what nothing in their training or indoctrination had prepared them for, was this: an American medical officer turning to them with bloodshot eyes and saying through an interpreter, "I need hands. Any hands. Can you work?" The question hung in the air like smoke from artillery fire. To understand the terror that gripped these women in that moment, one must first understand what they had been taught to expect. Throughout the war, German military and civilian populations had been fed a steady diet of propaganda about American barbarism. The Reich Ministry of Public Enlightenment and Propaganda, under Joseph Goebbels' meticulous direction, had painted Americans as mongrelized, culturally inferior, motivated solely by material greed, and incapable of the discipline and sacrifice that defined German superiority. Medical professionals, including nurses trained under the National Socialist system, received specific instruction that American medical practices were primitive, driven by profit rather than healing, and that captured German medical personnel would be either executed as accomplices to regime atrocities or subjected to degrading treatment as inferiors. The nursing corps of the Wehrmacht and Waffen-SS operated under a rigid hierarchical system rooted in both Prussian military tradition and National Socialist racial ideology. Nurses like Margaret Hoffmann had undergone training that emphasized obedience, racial consciousness, and the understanding that medicine itself was a tool of the state. The concept of Volksgesundheit, the health of the people, as collective rather than individual, permeated every aspect of their education. They had been taught that their primary duty was not to individual patients but to the biological strength of the German nation. This meant that medical resources were to be allocated according to racial value and military utility. The chronic waste they had witnessed, the abandonment of wounded soldiers deemed unfit for return to combat, the withholding of morphine and antibiotics from those considered racially inferior or politically unreliable, had been normalized as necessary pragmatism in total war. Moreover, these nurses had experienced firsthand the deterioration of German medical capability as the war ground on. By late 1944, surgical theaters and field hospitals often lacked basic supplies. Anesthesia had become scarce enough that amputations were sometimes performed with only schnapps or nothing at all to dull the patient's agony. Antiseptics had given way to improvised alternatives: boiled water, stolen civilian alcohol, even urine in desperate circumstances. Sutures were reused until they frayed. Bandages were washed and rewashed until they disintegrated. The nurses had learned to perform triage not based on who could be saved, but on who could potentially return to combat most quickly, with the remainder left to die with whatever morphine could be spared or, more often, with none at all. They had also witnessed the gradual moral corruption that scarcity breeds. Nurses who once took pride in their profession had become hardened, calculating, sometimes cruel. Stories circulated of medical personnel hoarding supplies for their own use or for trade on black markets. The fundamental compact between healer and patient had eroded, replaced by a grim utilitarian calculus where human life was measured against strategic value. Against this background, the American surgical tent represented something impossible, perhaps even hallucinatory. When Schwester Hoffmann and her colleagues first entered the American medical facility, they struggled to process what they saw. The Americans had electric generators powering surgical lamps bright enough to work without shadows. They had plasma bags and bags of it, hanging like bizarre fruit from metal stands. They had whole blood for transfusions properly typed and cross-matched. They had morphine in such quantities that it was administered liberally, without the agonizing calculations German medical staff had grown accustomed to making. They had sulfa drugs, penicillin, and antiseptics in abundance. They had surgical instruments that gleamed, sterile and sharp, not the dulled, overused implements that German surgeons had been forced to work with for months. But more disturbing than the material abundance was the American approach to the wounded themselves. The American doctors and medics worked on casualties without first asking their nationality or utility to the war effort. German prisoners received the same urgent care as American soldiers. A captured SS officer with a sucking chest wound was given plasma and rushed into surgery with the same speed as an American lieutenant with similar injuries. This violated everything the German nurses understood about wartime medicine.
It seemed not just impractical but actively perverse, a squandering of resources on enemy combatants who would, if recovered, presumably return to fighting against American forces. Yet here they were, and here was Captain Kerrigan asking them to assist.
The first to step forward was not Schwester Hoffmann, but the youngest among them, a girl named Anna Richter who had lied about her age to join the nursing corps in 1943. She was 19 years old. Though she looked older, the war had a way of aging faces faster than years. She moved to the surgical table where Kerrigan was working on an American sergeant whose intestines had been perforated by shrapnel. Through the interpreter, Kerrigan's instructions came rapid and precise. Retractor here, hold it steady. When I say, apply pressure to that bleeder. Anna's hands shook as she took the retractor. She'd assisted in abdominal surgeries before, but never like this. Kerrigan worked with a speed and confidence that seemed almost reckless by German surgical standards, yet his movements were precise, economical. He didn't waste time or motion. He spoke constantly, not just giving instructions, but explaining what he was doing and why, educating while operating, as though the surgery were a classroom demonstration rather than a desperate attempt to save a life. The American military medical system, Kerrigan said, his words translated in fragments, is built on the principle that every life has equal value. We don't calculate the strategic worth of a wounded man. We calculate the medical interventions required to save him. The rest is above our pay grade. This philosophy, so casually stated, represented a revolutionary challenge to everything Anna and her colleagues had been taught. In the German medical system, doctors and nurses were explicitly instructed to consider the broader needs of the Reich when making treatment decisions. A soldier who had already lost limbs and could not return to combat might be given minimal care while resources were redirected to those with better prospects for recovery and redeployment. The American approach treating medical need as the sole criterion for intervention seemed not just idealistic but dangerously naive. Yet as Anna held the retractor and watched Kerrigan repair the soldier's intestines with meticulous sutures, she found herself confronting an uncomfortable question. What if the American approach wasn't naive? What if it was actually more effective? The evidence, when one examined it honestly, was difficult to dismiss. The American military medical system in World War II achieved survival rates unprecedented in military history. Data compiled during and after the war revealed that American soldiers wounded in Europe had approximately a 96% survival rate if they reached a field hospital alive. This compared to roughly 85% for German forces in the same theaters during the same period, and even lower rates on the Eastern Front where conditions were more desperate. The American advantage stemmed from several factors: better supply chains, superior logistical organization, more abundant resources, but it also stemmed from a fundamental philosophical difference in how American military medicine approached the wounded. The American system operated on the principle that preserving soldiers' lives was not just a humanitarian goal, but a strategic one. A soldier who survived his wounds, even if he never returned to combat, could go home to contribute to the industrial and agricultural base that sustained the war effort. Moreover, knowing that excellent medical care awaited the wounded boosted morale across all ranks. American soldiers fought with the confidence that if they fell, their military would move heaven and earth to save them. This psychological advantage had tangible effects on combat effectiveness. German soldiers, by contrast, often fought with the grim knowledge that serious wounds meant probable death or, at best, abandonment to whatever care could be improvised in deteriorating conditions. The steady erosion of German medical capability as the war progressed had not gone unnoticed by frontline troops. Stories circulated of wounded men left behind during retreats, of field hospitals overrun and patients executed by Soviet forces. of amputations performed without anesthesia. This knowledge bred a particular kind of desperation. Men fought harder because they feared wounding as much as death, and they sometimes took unnecessary risks because strategic withdrawal meant abandoning wounded comrades to uncertain fates. As the hours wore on in that surgical tent in the Ardennes, more German nurses began to assist. Schwester Hoffmann found herself handing instruments to an American surgeon named Lieutenant Marcus Webb, who worked on a German prisoner with multiple shrapnel wounds to the legs. Webb spoke no German and Hoffmann no English, yet they developed a working rhythm through gesture and intuition. At one point, Webb paused to take a sip of coffee. There was always coffee, somehow, and offered the
cup to Hoffmann. The gesture was so casual, so devoid of triumphalism or condescension, that Hoffmann accepted without thinking. The coffee was real, not the acorn and chicory substitute she'd grown accustomed to. It was strong and hot and tasted like something from before the war, from a world where such simple pleasures were assumed rather than miraculous.
The symbolic power of that coffee cannot be overstated. Throughout German propaganda, American material abundance had been portrayed as decadence, as evidence of a society grown soft and weak through comfort. Yet here, in a forward surgical tent mere kilometers from active combat, the Americans had coffee. They had chocolate bars that medics distributed to patients after surgery. They had cigarettes, magazines, playing cards, objects that seemed frivolous, yet spoke to a deeper truth about American industrial capacity. The Reich had promised its people that victory would come through superior will and discipline, that Germany's spiritual strength would overcome material disadvantage. But confronted with the casual abundance of even front-line American medical facilities, that promise rang hollow. Schwester Hoffmann noticed other things as well. The American doctors spoke to their patients not barking orders or delivering clinical pronouncements, but actually conversing. She watched Lieutenant Webb reassure a terrified German private that he would keep his leg. Watched him explain the surgery in simple terms despite the language barrier. Watched him place a hand on the young soldier's shoulder in a gesture of comfort that transcended nationality. This too violated German military medical culture, which emphasized professional distance and emotional detachment. Nurses and doctors were taught that excessive empathy compromised clinical judgment, that maintaining authority required hierarchy and formality. Yet the American approach seemed to produce better outcomes, at least as measured by patient cooperation and psychological recovery. The German prisoners who passed through American medical care emerged not just physically treated, but psychologically affected. They had expected brutality or indifference and received instead competent, even compassionate care. This dissonance challenged their understanding of the war itself. If Americans were the mongrelized barbarians described in propaganda, why did they work so hard to save enemy wounded? If German superiority was real, why did German medical facilities lack the basic supplies that Americans seemed to have in abundance? These questions had no easy answers, and the nurses didn't speak them aloud, but they hung in the air nonetheless. As night deepened into the small hours of January 18th, a severely wounded soldier was brought in, a German officer with a traumatic amputation of the right arm and severe blood loss. He was unconscious, his skin gray with shock. Captain Kerrigan assessed him quickly and called for plasma and whole blood. Schwester Hoffmann, now working more confidently, helped establish the transfusion lines. The officer's uniform identified him as a captain in a Waffen SS Panzer Division, a detail that was not lost on the American medical staff. Several of the medics exchanged glances. The Battle of the Bulge had been particularly brutal, and stories of SS units executing American prisoners at Malmedy had spread through the ranks. Yet Kerrigan didn't hesitate. He worked with the same intensity he'd shown for American casualties, the same methodical precision. One of the American medics, a corporal from Pennsylvania whose name Hoffmann never learned, muttered something in English that the interpreter didn't translate fully, but whose meaning was clear enough. From his tone, why waste blood on an SS officer? Kerrigan paused just long enough to look at the corporal and say, because that's what separates us from them. Next question. The surgery took 3 hours. The SS officer survived, though he would wake to find himself not only a prisoner but permanently disabled. As Hoffmann cleaned and bandaged the amputation site after surgery, she found herself wondering what this man had done, what orders he had given or followed. The SS were not regular army. They were ideological warriors, true believers in National Socialism's most radical doctrines. Yet here he lay, saved by the medicine of the enemy he'd been taught to despise as racially inferior and morally degenerate. Over the following days, as the German nurses continued to work alongside American medical personnel, patterns emerged that deepened their cognitive dissonance. The The American system, for all its apparent chaos and informality, functioned with remarkable efficiency. Wounded men were triaged, stabilized, and moved through surgery and recovery with the regularity of an assembly line, though that comparison, with its industrial connotations, somehow fails to capture the human attentiveness that characterized each step of the process. American medics joked with patients. Doctors listened to complaints. Nurses provided not just medical care, but emotional support. The German nurses also noticed the racial composition of American medical units. They saw black medics working alongside white doctors, saw Hispanic corpsmen and Asian American surgeons. This too challenged their indoctrination. Nazi racial theory had taught that racial mixing produced biological and cultural degeneracy. Yet here were mixed-race units functioning effectively under combat conditions. The American military was hardly free of racial prejudice. Black medics often faced discrimination, and the units were frequently segregated, but compared to the German system's explicit racial hierarchy, American integration, however imperfect, represented a fundamentally different social vision. One incident crystallized the transformation occurring within these women. On the fourth day, a young German soldier, barely 18, with a facial wound that had destroyed his left eye and shattered his jaw, regained consciousness after surgery. He was terrified, disoriented, and pained despite morphine. He tried to speak but couldn't through his wired jaw. He began to panic, thrashing against restraints put in place to prevent him from damaging his surgical repairs. Schwester Anna Richter was nearby and moved instinctively to calm him. She took his hand, spoke to him in German soothing words, the kind a mother might use with a frightened child. She told him he was safe, that he would heal, that the doctors were skilled, and he would survive. An American nurse named Lieutenant Sarah Moskowitz watched this interaction, then approached with a morphine syringe to increase the young soldier's dose. Through the interpreter, she said to Anna, "You're good at this. You care about them. That's what makes a real nurse, not the uniform." It was a simple observation, almost throwaway, yet it struck Anna with unexpected force. She had joined the nursing corps believing she was serving a higher cause, the defense and purification of the German nation. She had absorbed the ideology, accepted the hierarchy, internalized the notion that some lives had more value than others. But in that moment, holding the hand of a terrified boy who would be disfigured for life, receiving affirmation from an American Jewish nurse whose very existence contradicted everything she'd been taught, Anna felt the ideological framework that had structured her understanding of the world begin to crack. The other nurses experienced similar moments of rupture. Schwester Hoffman found herself having a halting conversation with Captain Kerrigan about medical ethics. Through the interpreter, Kerrigan explained the American concept of the Hippocratic Oath as understood in modern practice. The duty to heal regardless of the patient's identity. The principle that medical decisions should be guided by patient welfare rather than political considerations. Hoffman mentioned carefully that German military medicine operated under different principles, that resource scarcity required difficult calculations. Kerrigan nodded, but his response was pointed. Scarcity becomes an excuse. We have scarcity too. We can't save everyone, can't provide everything, but we don't ration care based on whether a soldier is still useful to the war machine. That's not medicine. That's industrial management applied to human flesh. The conversation troubled Hoffman because Kerrigan's critique was accurate. She had witnessed the dehumanization inherent in German military medicine's approach, had participated in it, had rationalized it as necessary. Now, working within a system that operated on different premises and achieved better outcomes, she confronted the possibility that the dehumanization had not been necessary at all, that it had been choice, a reflection of values rather than constraints. The symbolic object that came to represent this entire experience was neither weapon nor flag, but rather a simple surgical scalpel. In German field hospitals, scalpels were reused until they lost their edge, then sharpened on improvised stones until the blades thinned to fragility. Surgeons worked with instruments that barely cut, that tore tissue as much as sliced it. In the American surgical tent, scalpels were sharp, often single-use, treated as disposable when necessary. To the German nurses, this seemed wasteful at first. Why discard a tool that could be cleaned and reused? But as they assisted in surgeries, they understood. A sharp scalpel allowed for precise incisions that healed cleanly. A dull blade caused trauma, increased infection risk, prolonged suffering. The scalpel became a metaphor for larger systemic differences. German medicine conserving tools at the expense of patients, American medicine prioritizing patient outcomes over material economy. Schwester Hoffman found herself thinking about the scalpel weeks later. After the German nurses had been transferred to a prisoner of war facility and then, eventually, processed for repatriation, she thought about it during the Allied occupation when she learned the full extent of Nazi medical atrocities. The experiments, the euthanasia programs, the systematic murder disguised as medicine. She thought about it when she had to confront her own complicity, not in those specific horrors but in the broader ideological system that had made them possible. She had known that some patients were denied care based on race or political reliability. She had known that morphine was withheld from those deemed unworthy. She'd accepted these practices as unfortunate necessities rather than moral catastrophes. The American surgical tent had shown her an alternative, a system that, for all its flaws and imperfections, began with the premise that lives had intrinsic value independent of their utility to state power. This was not naive idealism, but rather a sophisticated understanding that the purpose of medicine was healing, and that subordinating healing to political ideology corroded both medicine and politics. Historical records document the extent of this transformation across captured German medical personnel. After the war, Allied forces processed thousands of German doctors, nurses, and medics. Many underwent denazification procedures, were interrogated about potential war crimes, and were eventually released. Interviews conducted during this period reveal a common pattern. Exposure to American military medicine produced profound disillusionment with Nazi ideology among German medical professionals. They had been promised that German science and discipline were superior, that American material abundance reflected spiritual weakness. Instead, they discovered that abundance enabled better care, that informal American working methods produced superior outcomes, and that the supposed superiority of German culture was propaganda unsupported by evidence. Some German medical professionals resisted this realization, clinging to ideological explanations for Germany's defeat, betrayal by Jews, communists, or other internal enemies, the overwhelming material advantage of Allied forces, the supposed barbarism of Soviet tactics. But many others, particularly those who had worked directly with American medical units, could not reconcile their direct experience with propaganda narratives. They had seen too much, learned too much, been treated too decently. The case files from the Nuremberg medical trial, which prosecuted Nazi doctors responsible for human experimentation and euthanasia, reveal that some German medical professionals became witnesses for the prosecution, providing evidence against colleagues who had committed atrocities. Others simply withdrew from medicine entirely, unable to reconcile their profession with what it had become under National Socialism. Still others attempted to rebuild German medical practice along different principles, contributing to the post-war reconstruction of West German medical ethics. Schwester Margarete Hoffmann was among those who continued in nursing. She worked in civilian hospitals during the occupation and later in the Federal Republic. She never spoke publicly about her wartime experiences, but her personnel records note that she was known for patient advocacy, for insisting on dignity and care even for the most difficult or socially marginalized patients. Those who worked with her in later years described her as someone who brought an almost fierce intensity to the principle that every patient deserved compassionate treatment. They didn't know why she felt this so strongly, didn't know about the surgical tent in the Ardennes where she had learned that medicine could be something other than triage and abandonment. Anna Richter left nursing after the war. She married an American soldier she met during the occupation, emigrated to the United States, and worked as a translator. But in the 1960s, when her children asked her about the war, she told them about the American doctors who had let captured German nurses assist in surgery, who had treated them as colleagues rather than enemies, who had demonstrated through action rather than words what it meant to value life over ideology. The epilogue to this story unfolds not in dramatic revelation, but in quiet recognition. The American military medical system in World War II was not perfect. It was marked by the racial segregation prevalent in American society, by class distinctions between officers and enlisted men, by the inevitable stress fractures that appeared under combat conditions. American doctors and medics were not saints. They were ordinary men and women doing difficult work under terrible circumstances. They felt fear, prejudice, exhaustion, and despair. They made mistakes. They lost patients they should have saved. They struggled with the moral weight of treating enemy soldiers while American wounded waited. Yet the system they operated within was built on a fundamental premise that proved revolutionary to those who encountered it from outside. The premise that medicine existed to heal, that human life had value independent of political or military calculation, and that abundance should be used not as a display of dominance, but as a tool for reducing suffering. This premise was not uniquely American. Medical professionals in many societies shared similar ethical commitments, but the American military's institutional embodiment of these principles, backed by industrial capacity and logistical sophistication, created a functional demonstration of an alternative to Nazi medicine's ideological corruption. The German nurses who worked in that surgical tent in January 1945 witnessed this alternative in the most immediate, visceral way possible. They held retractors while American surgeons operated. They administered morphine that wasn't rationed by racial hierarchy. They saw wounded enemies treated with the same urgency as wounded friends. They drank real coffee while artillery rumbled in the distance. And through these small, concrete experiences, they learned that the ideology they had served was built on lies, not abstract lies about geopolitics or military strategy, but immediate, tangible lies about human nature and social organization. The terror they felt was not primarily fear of punishment or mistreatment. Though those fears were present, the deeper terror was ontological. The terror of watching one's worldview collapse, of realizing that the framework one had used to make sense of reality was fundamentally flawed. This is perhaps the most profound victory one system can achieve over another, not merely defeating it militarily, but demonstrating so clearly the superiority of different values that even the defeated recognize the truth of their own eyes over the comfort of familiar propaganda. In the end, the story of German nurses assisting American surgeons is not fundamentally about medicine, though medicine provides its setting and symbols. It is a story about the power of lived experience to challenge ideology, about the way direct human contact can dissolve abstract hatred, and about the revolutionary potential of treating people as individuals rather than as instruments of political will. The scalpel that cuts cleanly, the coffee that stays hot, the morphine given freely. These small abundances carried messages that no propaganda could fully counter, that some societies organized themselves around human flourishing rather than domination, and that this organization was not weakness but strength. The German nurses returned to a shattered country, to the ruins of the Reich that had promised them greatness and delivered catastrophe. They carried with them memories of American doctors who had turned to them in desperate need and said simply, "I need hands, any hands. Can you work?" In asking that question, the Americans had acknowledged the German nurses' humanity and professional skill even as their nations were at war. They had demonstrated that the enemy could be seen as fellow practitioners of healing rather than as objects to be destroyed. And in that recognition lay the seed of something that would eventually grow into reconciliation, into the rebuilt Germany that would become an ally rather than an adversary. 70 years later, when historians study the American military medical system in World War II, they focus on statistics, survival rates, logistical efficiency, technological innovation. These are important, measurable achievements, but perhaps the system's most significant accomplishment cannot be easily quantified: the way it embodied and transmitted values that would outlast the war itself. Values that would be carried forward by those who encountered them, even former enemies who had expected nothing but retribution and instead found professional respect, adequate supplies, and hot coffee in a surgical tent while snow fell on the Ardennes Forest and the war ground toward its inevitable end. The surgical tent is gone now, dismantled and forgotten. The soldiers and nurses who worked there have mostly passed. But what happened in that space, the surgeries performed, the lives saved, the worldviews challenged echo still. It echoes in the medical ethics that govern modern military medicine, in the Geneva Conventions that codify protections for wounded combatants, and the international humanitarian principles that affirm human dignity transcends political boundaries. And it echoes, perhaps most persistently, in the private memories of those German nurses who learned that their most fundamental assumptions about enemies and friends, about superiority and inferiority, about scarcity and abundance, were not eternal truths but contingent choices that other societies had made differently, with profoundly different results. That is the lasting victory, greater than any battlefield triumph, the victory of demonstrating that another way was possible, and that this other way worked not through domination but through acknowledgement of shared humanity. In the end, American abundance, material and philosophical, proved more powerful than German discipline, not because it was imposed by force, but because it was freely demonstrated and, once witnessed, impossible to deny. The German nurses were terrified not by American cruelty, but by American generosity, not by degradation, but by dignity, not by the vindication of their ideology, but by its complete and irrefutable refutation. And that terror, paradoxically, opened the path to liberation from lies, from hatred, and from the terrible weight of serving a system that had measured human worth in milliliters of morphine and the strategic utility of broken flesh.